Good afternoon. We have the great pleasure to welcome Ms. Rotem Sigall Boneh, clinical and research dietitian at Wolfson Medical Center in Tel Aviv, to discuss recent advances in the development of diets for Crohn disease. So, Ms. Rotem Sigall Boneh, as a lead expert in development of Crohn disease exclusion diet, how do you see the progress in nutrition in clinical practice and also the integration of the multidisciplinary team in practice?
So first of all, I'm very excited to see the progress that we achieved. If we are taking it from the DECO, even the DECO achievement, we can see how we started DECO a decade ago, 10 years of progressing. When we started, we didn't see any research on diet. Looking at those days, we can see several different diets, different or same mechanisms that are discussing and improving the care of our patients. So we can see the involvement of dietitian in research. We can see more dietitians that improve care of patients and providing guidance to support patients either with deficiencies or also to actually treat patients. So I think we kind of had a shift in our treatment where dietitians moved from just supporting patients and addressing deficiencies to actually treat the patients with specific diet. And we can see what done with the Crohn disease exclusion diet. And I have to say, I feel like a mother of a program that is now independent, and to see it's very exciting to see different groups that are trying to implement and even do research, individual research, to show the efficacy of the CDED in different populations, in different countries, different cultures, even with severe disease or other indications, pouchitis and so on. So it's amazing to see the involvement and the evolution of this diet, and we can say now that we did a lot and
Indeed.
we progressed a lot with the diet, and we established the role of diet.
Indeed, and along with this question, as you said, an inventor of Crohn disease exclusion diet and the lead expert in developing the modified program, to follow your point before, how you see the recent progress and particularly the new diets that are coming in this area.
So we have so many exciting studies and groups that are investigating the role of diet, and we are learning from each diet to support and to see what will be best for our patients. And we started more than 10 years ago. We need to remember it's kind of an evolution that we need to do with our diet and with our research as well. So if we started with specific diet, and then we try to put it more effort to change it, to see how we can challenge the diet and how we can improve better the care of our patients. And we can take an example from the FODMAP, who started as a very restricted diet and with time was more elaborate. And the news that we have this ECCO, we can see the results from testing healthy diet, they look promising. And again, it just emphasizes how the principles of the CDD, of the exclusion of dietary components that are potentially pro-inflammatory, which actually we're excluding the same ingredients. In the end of the day, we wanted to promote nutritional balance, and we recommended patients to consume a specific product in order to be able to implement it in other places. And also to integrate formula to make sure that we are not doing some nutritional deficiencies that might occur over time. So again, we are contributing each other. We have the CD3 that we are looking forward to see the results, and other diets. And also we had a new study that is coming from Italy, trying to see the CDD compared to Mediterranean diet. And it looked promising when the CDD was superior, but we need again to keep in mind that both diets did not, in this case specifically, did not reduce the CRP levels or calprotectin. So again, we need to keep in mind that and showing what all the data that we showed, how we can improve the symptoms, but also the inflammation. So we need to make sure about it as well.
Yes, and to follow on this point, and particularly on the effort made along the years, indeed, after a decade of research and development and a lot of clinical effort, the CDED is fully recognized at ECCO guidelines for its value and its benefit in the management of Crohn disease. So what you see as future directions?
First of all, I'm excited to say that we have published the diatomics as it's now available in the CGH, and we are learning, we're still learning, and there are a lot of open questions that we need to answer. First, we saw that maintenance could work in those patients, so we need to evaluate it more and to see how we can improve even better our maintenance strategy as well. We want to see who will be the patients that will be most benefit out of this diet. Can we predict who will be the patients who will respond? We know they're responding very fast when we showed previously in our studies. But again, we want to see from baseline we can do some research, even microbiome research or other supplements or not supplements, other biomarkers that can predict who would be the patients that will respond.
Thank you very much, Rotem. Thank you for this great conversation, and I wish you a great stay in Berlin. Thank you.
Thank you very much.